I'm not the house of cards that falls down easily. Ooh, I'm strong enough to handle what you throw at me.
Welcome to Mental Health News Radio. I'm your host, Kristin Walker. Just what are we going to discuss? The intimacy that is mental health. Let's continue to make it as comfortable as discussing brain health or heart health. This show has been on the air for several years, and we have amazing co-hosts. And then we created a network of podcasters on mentalhealthnewsradionetwork.com, a place where every possible facet of mental well-being can be talked about openly. My show, after several hundred interviews, the format is this: intimate, deep, funny, touching, sometimes uncomfortable, but always vulnerable conversations with interesting people. The goal is to have you, our listening family, many of you who have become my good friends, feel as though you are listening in on private conversations. Thank you for tuning in and becoming part of this amazing journey with me, and now with our network of podcasters. Just knowing this podcast might be helping any of you realize you are not alone on this journey called being a human being makes doing this podcast worth every second.
After all, we promised we'd be cordial.
Hey everyone, Kristin here. We are podcasting live this week in Carlsbad, California for CIBHS.org, the California Institute for Behavioral Health Solutions. They have a conference every year called the Behavioral Health Informatics Conference and Exposition. If you are an EHR vendor and you are not an exhibitor at this conference, you need to make sure that you are one. If you are an agency or anyone working in the mental health and substance use field that wants to know exactly what's going on when it comes to healthcare, technology, and business in behavioral health, you need to be at this conference. Enjoy our interviews. We'll be doing several this week, and thanks for tuning in. Hey everyone, Kristin Walker here. I am with Brendan McEntee. Did I say that right?
McEntee.
Jeez. Well, we're not going to edit that. So
confusing Irish names.
So tell our listeners what organization you're with and what the acronym stands for.
Sure. So I'm the Director of Quality and Science with the American Society of Addiction Medicine, or ASAM as we call it.
Yeah.
We're a medical professional society. We were actually founded in the 1950s by a group of clinicians who said, hey, can we work together to advance our practice of addiction medicine and share those best practices with the field.
Great.
Now in 2018, we have more than 5,100 members across the U.S. and the world,
amazing.
and our mission is to connect, advocate, educate, and treat.
Do you guys have a podcast?
We do, actually.
Okay.
Journal of Addiction Medicine is our scientific journal that we publish every 2 months. And with that, we have a podcast called Beyond the Abstract, Addiction Medicine.
Fantastic. I'll have to take a tune in and listen to that.
That would be great. It's on our...
Do you ever do it? Because I said before we started, you have a great voice for radio.
Not me. We have a great digital editor that joined our journal team just this year. Mm-hmm. He's a doctor. He's a fellow. And he does the interviews with authors from the journal.
Oh, fantastic. So why this event in California?
So ASAM is interested in helping folks really advance the practice of medicine. Mm-hmm. And California is really interesting. About 2 years ago, they were one of the first states that was approved for what was called the CMS 1115 demonstration waiver for substance use disorder funds. That essentially gave California the ability to access additional funding to provide residential services. In the past, they were called, I'm using quote signs, IMD exclusions, meaning that they weren't funded to provide residential care. CMS said, now we want to provide states the option to access funds for these services. And in order to do that, we want them to demonstrate that they're delivering quality care and using national standards, both on the assessment side. So they said they wanted assessments that were done in a standardized way,
right.
And also on the delivery side. So they said they wanted a full continuum of addiction care being offered. One of the examples that CMS provided was a national practice guideline that ASAM created in the actual 1980s was when it started.
Wow.
Called the ASAM criteria.
Right.
And we're helping folks really do standardized implementations across the U.S. And in particular, this conference, because all the counties are here, Medicaid counties, we're looking to help them be able to implement the criteria.
Okay, well, fantastic. And then your decision to exhibit here is based on your work with CIBHS?
Our desire to connect with all the counties.
Oh, gotcha.
So
okay.
our goal is to help them implement the ASAM criteria in a standardized way, because research on it shows that when patients are matched correctly to care, they're more engaged in treatment, they're more likely to show up to treatment, and they're more likely to get healthier faster. And it's interesting because research also shows if they're overmatched. So say someone was supposed to go to an outpatient center and they ended up at a residential level of care, so they're getting more intensive services than they need. Research always also shows that those outcomes are worse. So we're trying to help ensure that counties, states, et cetera, whoever's using the criteria when they implement it, are really doing a superb job of matching the needs of patients to the services so that they can get healthier faster and systems save resources.
Fantastic.
It's interesting, one of the largest institutions of our clinical decision software called Continuum is in LA County, and they're using the software across their 1,500 different clinicians. It's creating a wealth of addiction data. There's now more than 3,000 assessments being used in that software. And with each one of those assessments, we get about 100 to 150 data points about a patient. And that can be used to understand the population health and really say, in this area, we need this type of treatment. In this other area, we need this type of treatment. These are the patients that we're seeing. This is where we need to expand. This is where we need to reduce.
Okay. Great. How long have you guys been coming to this particular?
Last year was our first year here. We're definitely going to come again next year.
Yeah, this is an amazing venue. I've been really pleasantly surprised. Knew it would be, but just the people that we've interviewed and the seriousness of, everyone here about why we're in behavioral health.
It's great. I think they do a really good job because it's there's a lot of opportunity for connections, which you don't really see at conferences.
Right.
And for me as a non-clinician, the content is very approachable, so I learn a lot from it as well.
Yeah, the times that you haven't been at the booth, you've probably been in a session.
Exactly.
Yeah, amazing. Well, thank you so much for agreeing to come in
Thank you.
Talk. And thank you to our listeners for another edition of Mental Health News Radio.
But never without good intentions. I heat up and act on my emotions.
Thanks so much for listening to Mental Health News Radio. Our podcast can be found on iTunes, Stitcher, and hundreds of other podcast apps, or you can visit our website at mentalhealthnewsradio.com. If you have a question or would like to be a guest, become a podcaster on our network, or join the amazing organizations that help keep us on the air, please email us at info@mhnrnetwork.com. Get ready for that special goodbye from our resident therapy dog, Miles, and a special thanks to Emily Sohn for letting us use her incredible song, Cordial, for our podcast music. Listen to the full song on SoundCloud at emily.sonne.
Don't be surprised when I don't hate on you. After all, we promised we'd be cordial. Sometimes in you I can fight it.
Good boy.
Napa know-how.
If you know how to pick something up and put it in a bucket, you know how to save 20%. This week only, buy a Napa bucket for $2.99, fill it to the top, and boom, you're a savings genius. So hurry in and save, because the Napa 20% off deal ends soon. Quality parts, helpful people. That's Napa know-how.
Napa know-how.
At participating stores, exclusions apply. Minimum 3 items. Offer available July 23rd through July 31st.